Certainly, my colleagues and I have published substantially on the importance of cardiorespiratory fitness, or CRF, and cardiovascular disease outcomes and cardiovascular disease mortality, including many studies in the Mayo Clinic proceedings. There's also been many studies, some by my colleagues and I, on that cardiorespiratory fitness protects against certain forms of cancer. But in this manuscript, we specifically are assessing the importance of CRF in protecting against non-cardiovascular disease mortality and non-cancer mortality in a large group of men, 37,000 men in the Aerobic Center longitudinal study. I'm Dr. Carl Chip Levy. I'm Medical Director of Cardiac Rehabilitation and Preventive Cardiology here at the John Ochsner Heart and Vascular Institute, Ochsner Clinical School, the University of Queensland School of Medicine here in New Orleans, Louisiana. I also happen to be one of the associate editors and the cardiovascular section editor of the Mayo Clinic Proceedings. But I'm here today to discuss our new paper entitled Cardiorespiratory Fitness Predicts Non-Cardiovascular Disease and Non-Cancer Mortality in Men, which is now published online in the Mayo Clinic Proceedings and will be in an upcoming issue of the journal. I'd first like to acknowledge and congratulate the excellent efforts of my first and lead author, Dr. Joshua Sparks, and our senior author, Dr. May Shui, and our other co-authors who did an excellent job throughout the processing and review of this manuscript. We assess non-cardiovascular disease and non-cancer mortality in 5 different domains. First, diabetes and renal disease. Second, chronic respiratory diseases. Third, acute respiratory diseases and infectious diseases. Fourth, injuries. And 5, other non-cardiovascular disease and non-cancer mortality. I'd first like to say that regarding injuries, there was no significant impact of CRF on mortality from injuries, but there was very significant impact in all of the other endpoints. Moderate and high levels of CRF had substantial protection against total non-cardiovascular disease and non-cancer mortality by 43% and 57% respectively. Moderate and high CRF had substantial protection against mortality from diabetes and kidney disease by 61% and 83% respectively. Regarding chronic respiratory disease mortality, moderate and high cardiorespiratory fitness produced 64% and 91% respective reductions in mortality. Regarding acute respiratory illness and infectious diseases, moderate and high CRF produced reductions of 26% and 64% in non-cancer and non-cardiovascular disease mortality. And finally, for other categories, moderate and high fitness reduced non-cardiovascular disease and non-cancer mortality by 52% and 62% respectively. So that, I think, is pretty impressive that now in this paper, I think for the first time in the Mayo Clinic Proceedings, we extend the benefits of CRF to not only cardiovascular disease and cancer mortality, but also mortality from many other sources, again, for the first time published. Certainly, there is major evidence of the importance of CRF in the literature, particularly against cardiovascular disease, particularly against cardiovascular disease outcomes and cardiovascular disease mortality. In fact, in many studies, CRF is the most important cardiovascular disease risk factor for predicting prognosis. And also, as I mentioned earlier, there's substantial evidence that CRF is protecting against certain types of cancer mortality. certainly my colleagues and I have also published that changes in CRF, improvements in CRF over time, also predict cardiovascular disease prognosis and mortality. Hopefully, future studies are going to assess the importance of changes in fitness in cancer mortality and in mortality from non-cardiovascular disease and non-cancer mortality. There is certainly a hereditary or genetic component of fitness. Some people are naturally fitter than others. But the main way to increase fitness is with physical activity, and particularly some physical activity and exercise training that is at higher intensity and higher exercise heart rates, which is needed to improve substantially cardiorespiratory fitness. I believe that this study that we're publishing now certainly adds to and supports an editorial that I had in the Mayo Clinic Proceedings right at the beginning of COVID, that is fit is it for COVID and beyond. Certainly, higher CRF was shown early in COVID to predict against COVID mortality. And in fact, along that line, we have a major paper coming from a large Veterans Administration cohort that is really going to show some details about how much CRF protected against COVID mortality. But I think that now we have extended the benefits of CRF in this paper, and we have to face reality that our colleagues and myself, exercise scientists and clinicians, have not done a good enough job of getting our patients, getting the general public to achieve good levels of physical activity and fitness. And hopefully going forward, this information will help us do that, getting the general public and all of the patients that we are seeing in the office in primary care and internal medicine subspecialties to increase their physical activity and increase their levels of cardiorespiratory fitness. Thank you very much, and I hope this information is helpful.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.